Hello, my name is Dr. Adams, and I'm a dentist at Maryland Holistic Dentist in Burtonsville, Maryland. And today we're going to be talking about full mouth dental implants. And specifically, I'm going to be comparing two of the most popular full mouth implant options. First one is the Snap On Denture. I don't know if you guys get a good look at this, but these are teeth that come in and out of the mouth and they snap on to implants. And the second option is the full mouth, all on 4, all on 6 implant bridge. So this bridge is one that stays permanently into the mouth. Essentially what we'll do is we'll put in a series of implants, 4 or 6 implants, and there are teeth that get fastened permanently down on top of the implants. So I'm just going to go over the pros and cons of these two different cases. The first thing I want to point out, just because it's a really big deciding factor, is the all-on-4 and the all-on-6 implant bridges cost a lot more money, and this is for two different reasons. The first one is the dentist will typically use a lot more implants. 6 implants is typically 5 or 6, that's typically the number of implants that I use to replace a full upper or a full lower. And then the bridge itself is made by a 3D printer out of zirconia, and it's milled out. It's designed on a computer system that's milled out by a multi-million-dollar milling unit, and these teeth cost over $10,000 per set just to have them manufactured. So that is the first big difference. The implant denture, this is made out of acrylic, typically requires fewer implants. This is a set that's for a lower, and there's 2 implants in here, and the implant denture that gets snapped on. Here in a minute, I'm going to bring the camera over and show you a little more closely what these look like. But these teeth are plastic, acrylic, whatever you want to call it. They're bought off the shelf, and they're put into an acrylic matrix, and 2 to 4 implants is a number of implants that you need for these dentures to snap down onto. The dentures cost a lot less money to make, and since there's fewer implants, these snap-on denture, implant dentures, whatever you want to call them, are much less expensive. They literally are half the price of these implant bridges. The one big question that people will have is they'll say, well, how much do these cost? And the thing you might want to think about is not only what it costs now, but what it costs later, and what it's going to cost for you to maintain these teeth. The all-on-4, the all-on-6 implant bridge typically gets permanently placed, and the zirconia is a very stable material. It will never break. I mean, there's a lifetime guarantee on these things from the lab. They literally don't break. It's like a block of granite. This stuff is super, super strong, and you can put an infinite amount of pressure on these things and they will not break. They also are non-porous. They're not going to absorb any stain. They're not going to stink and begin to smell over time. You're not going to have a negative experience where you're biting down on something and have one of the teeth fly off. This is one block of material. Your maintenance cost will literally just cost you what it costs to go in and have your teeth cleaned regularly by the dentist. You should still go in and have the dentist take x-rays of the implants, make sure they're healthy, clean around the bridge, maybe once in a blue moon if you're not cleaning properly underneath the bridge. You may have to have the dentist remove the bridge, which is the easiest, undoing the 4 or 6 screws, taking the bridge off, cleaning and putting it back in. This is not a very complicated thing. Your maintenance costs for these all-on-4, all-on-6 bridges are really not going to cost you any more than you've been paying on your own teeth, except for they don't rot, they don't need root canals, you're not going to need any more fillings, no more crowns, no more nothing, just teeth cleans, okay? The implant denture, these snap-on dentures, is a much different story. Well, these are a much less expensive option. These teeth are placed in the acrylic plastic matrix. and they're nowhere near as strong. Over time, the fit, because this dentures, there's still a denture. The denture it absorbs biting pressure by you biting down, and the denture, the forces are partially on the gum and the bone and partially on the implants. It's like a shared force distribution where the implant permanent bridge, all the forces is on the implants. If the gums and bone shrink over time, which invariably is going to happen where you don't have teeth, the support for the denture will get less and less, and you'll have to have procedures like a reline. You'll have to like add material in here to fill the space where bone's lost. If that's not done, then it's like having a concrete sidewalk without dirt underneath of it. It can crack and break, and there's maintenance procedures, long story short, with these implant dentures. The other thing is the connection between the male and the female snaps can wear out. They've corrected this problem by putting little plastic inserts in the female side. It's in the denture. They have to get replaced every 6 months. They wear out, and the dentist will put this little tool in here and take it in and put a new one. It's kind of like putting an O-ring and like a plumbing fixture, and once you get that done, it takes you like 30 seconds and the thing's snapping back in there like new. Sometimes patients get a little lazy and they won't come in for their appointments often enough, and you'll start getting the plastics worn out, and you get like metal on metal, and somebody can destroy one of the attachments, and then that'll end up having to be replaced. That gets more expensive. And invariably over time, could be 5-10 years, the denture plastic material is porous, so it'll begin to get discolored and absorb smells, and it'll start to stink and look nasty, and the teeth will wear out, and you'll need a new denture, which can be done. You don't need new implants. You may or may not need new attachments, but it's much less expensive than getting a new implant denture, because a lot of the cost for getting these full mouth teeth done is the cost to remove the teeth, do the gum and bone work, and then get the implants in there. The implants should really never go bad, but you certainly might need a new denture with this case here. So the maintenance costs are a lot of times something that people don't consider as part of the cost when they're saving. These Snap On Dentures are literally 50% of the cost of these full mouth implant bridges. So, well, there you have it. If you really want to know what the cost is on these, typically what we'll do in our office is we'll put one fee on it. So if somebody's coming in, they need to have all their teeth removed and implants put in and the teeth put on top. We'll take all the bad teeth out, put the implants in, and put some same day teeth in there, and obviously the gum and bone is going to heal and change shape, and then we'll put the permanent teeth on depending on which one of these options you're selecting. And what we'll do is we'll just put one price on the entire case. Unless somebody wants to be put to sleep, we do put people to sleep for dental work. These are more, longer, more intensive procedures. So the only thing we actually charge an extra fee for is the sedation. But we'll put one price tag on the all-on-4 case, and another price tag on the implant denture case. And typically for a full mouth case, soup to nuts on these implant dentures, it'll cost between $25,000 to $35,000 to get the whole case done. And then if you're doing the all-on-4 case, soup to nuts, this is a $45,000 to $55,000 case. And if you want to come into the office, we don't charge for consultations. Come on in and meet me. I'm Dr. Adams, and I'll personally go over your case. One of the other nice things about our office is you will not need to go to any other dentist. With our office being an implant center, I have all the training, and I'm the only one you're going to have to meet. I'll put the implants in and put the teeth on top, and most of the time these full mouth cases involving implants will take 4 to 6 months to complete, and it will not involve you going around without teeth. So there you have it. All in for full mouth implant teeth versus Snap On Dentures. I hope you learned a thing or two. Have a nice day.